So the cervical plexus is the first one that we'll talk about, and the cervical plexus is composed of nerve root contributions from C1 through C5, plus also a branch from cranial nerve number 12, the hypoglossal nerve. And I'll elaborate a little bit more on each of these plexuses as we go along here, but let's just outline the basic neurologic makeup of each of these plexuses. So that's the cervical plexus, and then the brachial plexus. The brachial plexus is formed from nerve root contributions of C5, C6, C7, C8, and T1, with also occasional contribution from C4 and also T2. And the AMA guides use the terminology inconstant contribution, is how the AMA guides refer to the contributions of C4 and T2. So for our purposes, we're going to consider the brachial plexus to consist of nerve root contributions from C5 to T1. Then we have the lumbar plexus, which is composed of nerve root contributions from L1 to L5. And then finally the sacral plexus consists of nerve root contributions of L3 through S3, and also S4 if you consider the pudendal nerve to be a part of the sacral plexus. And all of these plexuses and all of these nerve roots, all the way from the top of C1 to the bottom all the way down to S4, all of these nerve roots are mixed in that they carry all three of the types of fibers that are described in the AMA guides, and we even talked about a fourth type of fiber traveling in these spinal nerve roots, and that is there are both somatic afferent and efferent fibers. We refer to those as the GSA, or general somatic afferent fibers, and the GSE, general somatic efferent fibers. And then also traveling in these nerve roots are autonomic nerve fibers, again both sensory and motor fibers. Those we refer to as the GVA, general visceral afferent, and GVE, general visceral efferent fibers. And then once we have all of these plexuses, the cervical, brachial, lumbar, and sacral plexus, all of those nerve roots then coalesce into the named peripheral nerves that then travel out into the body and make up the bulk of the peripheral nervous system. Now, if you've ever seen listings of all the named peripheral nerves in the entire body, the list is extremely long, and we're not going to talk about each and every named peripheral nerves, but we'll talk about the ones that the AMA guides consider to be important, at least as relates to some of the common impairments that you'll see related to the head, related to the upper extremities, and then also related to the lower extremities. So out of the cervical plexus, probably the two most important named peripheral nerves that you may encounter clinical exam findings with will include the supraclavicular nerve and the phrenic nerve. In the brachial plexus, of course, you're all familiar with the axillary nerve, the musculocutaneous nerve, the radial nerve, the median nerve, and the ulnar nerve. And I remember in chiropractic school we had a mnemonic to remember the named peripheral nerves that come off the brachial plexus, and that was that my mother is usually always right. Musculocutaneous, median, ulnar, axillary, and radial. And in addition to those five, I also list here for you the importance or an important peripheral nerve named the suprascapular nerve. And the reason I mention the suprascapular nerve is because I myself personally have recently run into two cases of suprascapular nerve entrapment at the scapula. There's 2 points of possible entrapment of the suprascapular nerve, and honestly, up until about 18 months ago, I had never heard of a peripheral entrapment of the suprascapular nerve. But since then, I've seen 2 bona fide cases of it, and it's a very interesting condition. Suprascapular nerve palsy is a very interesting condition. And so I mentioned that here as one of the named peripheral nerves from the brachial plexus. The suprascapular nerve is largely a C5 nerve. It also has, according to some authors and some textbooks, has contribution from C6. So I've seen 2 descriptions of the suprascapular nerve. Some texts describe it as a purely C5 nerve, while other texts describe it as being composed of contributions from C5 and C6. But anyway, it comes off of the superior trunk either immediately before C5 and C6 combine to form the superior trunk, or it comes off immediately after the superior trunk, after C6 has already come in and contributed fibers to comprise the superior trunk. So I've seen it described at least 2 different ways, and I mention it here for you to quicken your attention to possible cases that involve the suprascapular nerve. With the lumbar plexus, important peripheral nerves that we'll talk about include the ilioinguinal nerve, the iliohypogastric nerve, the genitofemoral nerve, the lateral femoral cutaneous nerve, and then obviously, of course, the femoral and obturator nerves. And then down in the sacral plexus, coming off the sacral plexus, important named peripheral nerves that you'll encounter in your examination of injured workers involve the inferior gluteal nerve, the superior gluteal nerve, the tibial nerve, the common peroneal nerve, and of course those 2 combine to give us the sciatic nerve. And then also there's a variety of different cutaneous nerves that provide sensation for the thigh and for the portion of the leg below the knee and even into the foot. Probably the most clinically encountered would include the posterior, would be the posterior cutaneous nerve of the thigh, causing pain in the back region of the thigh. So let's review now these plexuses, starting with the cervical plexus, which we'll just discuss briefly, and we'll spend more time on the brachial plexus, and I want to spend even extra time on the conus medullaris and share some of the fascinating anatomy of the conus medullaris with you. And then once we establish a good understanding of the anatomy of the plexuses and the named peripheral nerves, then in part 2 of this program we'll get into the neurologic examination of all these structures. So beginning up in the cervical spine with contributions from the C1 and C5 all the way through C5 nerve roots, we have the cervical plexus. Also contributing to the cervical plexus is a branch of cranial nerve 12, the hypoglossal nerve. And the cervical plexus is buried deep in the neck underneath the sternocleidomastoid muscle. And as I said, it's composed of the ventral primary rami of cranial nerve 12 and then C1 through C5. And most of the branches of the cervical plexus are sensory nerves, cutaneous sensory nerves that supply the dermatome from the skin of the neck, from the skin of the ear area, from the skin on the back of the head, and small portions of the skin over the shoulder. And also some of the branches, a much lesser percentage of the branches, are motor branches that innervate muscles of the anterior neck. So, for example, the infrahyoid muscles, such as the omohyoid, the omohyoid, the sternohyoid, and the sternothyroid muscles, are served by some of the upper C1 through C3 nerve roots. Some of the deep muscles of the neck, such as the geniohyoid and the thyrohyoid, the scalene muscles, some of the portions of the levator scapulae, and even portions of the trapezius and sternocleidomastoid muscles in conjunction with cranial nerve number 10, the accessory nerve, are all served by the cervical plexus. And then, as I alluded to earlier, C3 through C5 combine to form the phrenic nerve, which serves the diaphragm muscle, and that is the sole motor innervation of the diaphragm muscle comes from the cervical plexus and the phrenic nerve. Continuing downward, then as we continue down the cervical spine, we see the cervical spine nerve roots C5, C6, C7, C8, T1, and then also occasional contributions also from C4 and T2 gives us the brachial plexus. And so let's spend some time here now on the brachial plexus. The brachial plexus is situated partly in the neck and then partly also in the axilla, gives rise to virtually all the nerves that innervate the upper extremity, and we're going to be talking about those as we go here, specifically focusing on the median, ulnar, and radial nerves. The brachial plexus is formed by the anterior primary rami, again C5 through T1 with occasional contribution from C4 and also from T2. Now, after the nerve roots come off the spine, the nerve roots of C5 and C6 join together or fuse. The nerve root from C7 continues unfused, and then the nerve roots from C8 and T1 fuse, and those form in sequence the superior trunk, the middle trunk, and the inferior trunk. So the superior trunk is C5 and C6 combined into one contained sheath. It's called the superior trunk. The middle trunk is all C7. The inferior trunk is combined of C8 fibers, T1 fibers, and then occasionally contribution from T2. So here we see 5 to 6 to 7 individual nerve roots coalescing and combining into a reduced number of 3 trunks. And it's in the trunks that we see our first mixing and mingling of nerve roots. And with the superior trunk, we're mixing C5 with C6 nerve roots, and inferior trunk, we're mixing C8 and T1 nerve roots. Well, the trunks then immediately divide. So we have 5 nerve roots, 5 to 7 nerve roots coming in to form 3 trunks. And then the 3 trunks immediately divide into 2. Each trunk divides into 2. They divide into 2 divisions. And each trunk has both an anterior division and a posterior division. So bear with me now and follow along. The superior trunk divides into an anterior division and a posterior division. The middle trunk divides into an anterior division and a posterior division. The inferior trunk divides into an anterior division and a posterior division. So we have 5 to 7 nerve roots that combine to form 3 trunks. The three trunks then subdivide. Each trunk divides twice into an anterior and posterior division. So three trunks give us six divisions. The six divisions then undergo combinations to give us three chords. Did you follow that? 5 roots gives us 3 trunks, gives us 6 divisions. Now the 6 divisions, there's 2 categories of divisions. There's anterior divisions and posterior divisions. So that's 6 mixing and mingling groups of nerve root fibers. These 6 divisions then condense into 3 chords, and then the 3 chords then either combine or divide or continue on to give us the 5 major named nerve roots of the upper extremity, that being the axillary nerve, the musculocutaneous nerve, the median nerve, the radial nerve, and the ulnar nerve. Now the chords, there's 3 chords. There's a lateral chord, there's a posterior chord, and there's a medial chord, and those chords are named in relation to their position relative to the axillary artery. So of course the posterior chord is posterior to the axillary artery, medial chord is medial to the axillary artery, etc. And then all along the chords, several smaller nerve branches branch off, and these are named peripheral nerves, such as the upper subscapular nerve, the thoracodorsal nerve, the lower subscapular nerve, and these supply muscles and skin of the shoulder and also the superior part of the thorax. Okay, for those of you that have the PowerPoint, I have a diagram here of the brachial plexus, which I had to search far and wide for a good diagram that gave a good representation of the mixing and the mingling of the nerve roots. And what's amazing to me is, and I could stare at this picture all day, is that we start out with 5 nerve roots, and let's just call them the nerve roots from C5 through T1, 5 different nerve roots. Excuse me. And by the time we get out to the named peripheral nerves, we find that some of the fibers, for example, from the C5 nerve root, those C5 nerve root has given contribution to all of the named peripheral nerves, with the exception of the ulnar nerve. I shouldn't say all, I should say 4 out of 5. So C5 contributes to the axillary nerve, contributes to the musculocutaneous nerve, contributes to the median nerve, contributes to the radial nerve. And that's just that's amazing to me. And what we're seeing here is that these nerve fibers have migrated embryologically with the dermatome, the myotome, and the sclerotome to parts far and wide. You know, to parts of the body as near as the deltoid muscle and as far as muscles in the hand. For example, the lumbrical muscles have contributions from C5. And that's an example of how the nerve fibers migrate along with the dermatome, the myotome, and the sclerotome. And by the time these nerve fibers get out in the periphery, they have to return back to the spinal cord in different bundles. And we call those different bundles, and those multiple bundles, we call those the named peripheral nerves, the median nerve, the ulnar nerve, the radial nerve. That's what we call these bundles that carry these contributions from these 5 nerve roots originating from the cervical spine. And I have another diagram here for you, those of you that are watching the PowerPoint presentation, which is in color. And again, it shows a very good depiction of how the nerve roots get mixed. And we have to bear in mind that there's mixing not only of motor nerve roots, but also of sensory. I shouldn't say nerve roots, I should say motor fibers and sensory fibers. And for those of you that are watching the PowerPoint, it shows here the 5 nerve roots, each one starting out as a different color. For example, C5 is depicted in red. Well, if you trace red all through the mixing and matching and combining of nerve roots through the trunks, divisions, and the cords, and ultimately into the branches, you see that their red C5 contributes to many of the named peripheral nerves. Similarly, C6 contributes to all but the ulnar nerve. C7 contributes to all but the ulnar nerve. C8 contributes to both the radial and the ulnar nerve. T1 contributes to the radial nerve and the ulnar nerve. And so the brachial plexus is really a way that nerve fibers leave and return to the spinal cord from parts far and wide in the upper extremity, as those parts far and wide have migrated from the original segmental level, now only to return through various cords and bundles that we call the named peripheral nerves. So the posterior cord of the brachial plexus is formed by the 3 posterior divisions of the trunks. Recall that there was three trunks, a superior, a middle, and an inferior trunk, and then those each divided into anterior and posterior divisions. Those anterior and posterior divisions then recombine into cords, and one of which is the posterior cord, which lies posterior to the axillary artery. That is formed from the 3 posterior divisions of each of the trunks. Those all combine to form the posterior cord. Well, that only leaves then the anterior divisions of the 3 trunks. And the lateral cord is formed from the anterior divisions of the upper and the middle trunks, and the medial cord is simply a continuation of the anterior division of the lower trunk, or the inferior trunk, which is comprised of contributions from both C8 and T1.